Hi, y'all. This is Candice with Slusher Consulting. Today, I want to talk about emergency planning with your clients. And the reason why this is more important, in my opinion, in the non-medical home care realm is because when home health and hospice goes in, it's usually more of a temporary situation. So home health typically discharges within 60 to 120 days, not always, but that's their goal, is to get their patients better and discharge. So they don't really consider emergency planning to be such a big deal. And because they're not there all the time, like we might be, then, they're only popping in for 45 minutes to an hour. So they don't have the same level of basically commitment as to what's going to be happening. Now, they have to run a drill, they have to still have a plan. That's not any different. But typically, we find in the non medical space that we have to treat emergency planning a little differently, maybe even more importantly, for our clients' purposes. So I just want to talk about planning with your client. Now, when you go through the assessment process is the ideal time to do that, except that the assessment process can already be an hour or 2 hours long. And by the end of that, can we just stop talking? We're kind of done now. So if you don't find an opportunity to do your emergency planning with your clients at the time that you admit them, then I recommend when you go back for your first visit to introduce your caregiver, or certainly within the first 30 days, you make an additional visit to sit down and talk to them about what will happen in case of a true emergency. Now, usually that is a weather related emergency, flooding, ice storms, could be a fire in the neighborhood, though, could be a chemical spill on the highway close by, could be anything. So they need to know what they're going to do. Now, your responsibility in this is limited. It's not your job to plan for them, but just to give them resources. It's not your job to be their emergency backup. Now, obviously, if there's a staffing issue and you don't have a caregiver, you're going to send a new caregiver. But when there's an emergency that's affecting the whole area, you guys are not EMS, you're not first responders. It is not your responsibility, any different than if a client called you because they fell on the floor in the middle of the night and they don't have night shifts. Your response would be call 911 and have them come pick you up and check you out. We're not coming. Right? It's the same thing. You're not going to rent a tractor and take your caregivers to work when there's an ice storm and the roads are closed. So if somebody's not coming, somebody's not coming. And even if there's 24-hour care, again, because we're in the non-medical space, there is no nurse abandonment type of situation where somebody's license is on the line if they leave a client alone. And while you would hope that the caregiver would do the right thing and make sure that the client has everything they need before they leave, if things are really going down and there's a true emergency, your caregivers have families. They need to go and take care of their families if they can get out physically. So you can't count on them staying either, even if there's something going on. So ideally, you're going to want to just give them emergency preparedness resources. So a list of how to make a go bag, or making sure that you have a whole extra week of medication always set aside in case you need it for an emergency, making sure that you do have food that can be prepared without electricity, right? Packaged food that could just be eaten, granola bars, things like that, and extra bottles of potable water in case there is a boil notice or flooding, or again, in case they just have to go or all the pipes freeze, they need extra water. You're also going to want to give them, and that just can come, you can Google that. If you don't have those resources, you can just find things like, the Red Cross has recommendations for how to create an emergency kit for your home, that, batteries, flashlights, that kind of thing. Okay, you're going to want to give them a list of local emergency contact numbers. So whatever region you're in or city or area you're in, you're going to want to have all of the emergency contact numbers, meaning fire department, police department, Red Cross, and maybe some of the non-emergency numbers, even if they need to be able to call someone and ask for assistance. Of course, in Texas, we have something called 211 that people can always call, and they can register themselves for the STEER program. But if you're outside of Texas, everybody's emergency resources are a little different. So you're going to want to research and make sure that you have just sort of an emergency packet put together that you can hand to your clients so that they can plan for themselves. Okay. But you definitely want to ask them, what's going to happen here if you need to evacuate? If there is a fire in the neighborhood, And you might need to assess that. I mean, you can ask that question and not all your clients can answer, right? So if they don't have family members to plan with, you may need to advocate a little more for them and assess what is their level of vulnerability should they need to evacuate, but also if a caregiver can't come today. Okay. In Texas, we have to classify our clients based on priority in case of an emergency. And the priority is based on their level of vulnerability. Okay. So in the state paperwork, the verbiage is levels 1, 2, 3, and 4. And a level 1 means that they could die if they have interrupted services. You have to guarantee uninterrupted services. And as far as I'm concerned, in non-medical, if they could die, if you're not there, they're too acute to just be non-medical. Unless they have also 24-hour nursing, or there is family that lives there, or maybe they're in a nursing facility or an assisted living, that's fine. And that facility's emergency preparedness plan is going to supersede yours anyway. So then they would actually be the lowest level. They'd be a 4, meaning they could sustain extended periods of time with interrupted service with no care. And then, so the level 2 is they can go 24 to 48 hours. A level 3 is 48 to 72. And a level 4 is longer than 72 hours without care. Now, your 24/7s, even your bedbound clients, most likely, if they went 24 hours without care, they would be dehydrated. They'd probably have breakdown. But if they're in danger of, if it's life-threatening to not have care around the clock, you need to consider that those clients are too acute for you. And you don't want to promise that you're always going to be there and it's uninterrupted. You literally cannot promise that. Okay. So just be mindful of that. You don't ever want a level 1 in Texas. But again, when you're assessing their vulnerability, it could be a matter of a husband who is bedbound and his frail little wife is not going to be able to physically get him out, or the client lives alone and has just enough dementia that it's questionable whether or not they would understand that hearing a siren means there's something going on and they need to call 911. So it could be cognitive, it could be physical, it could be that one client is in a scooter and the other one's in a walker and they can't drive, they can't help themselves. So the first question is, who is your backup person? Who can you call when there is an emergency and when we cannot come? Okay. And if they don't have that answer, then that's when you might want to consider registering them with the local emergency responders, which again in Texas is 211 or STEER. In other states, that's going to be a different program. But with that, when you register them, if there is a flood or a fire and then in the neighborhood and people need to be evacuated, then they are already on a list for people to go check on. Okay. If it's not something that severe and you don't register them for 211 and you don't have, they don't have a backup, then when a true emergency happens, and you know that they're without any help, you might actually need to go ahead and call 911 to have somebody come and check on them. Okay. Anything could happen. So just be mindful. Now, again, you're not the emergency. It's not really your responsibility to plan for them, but to give them the resources and try to plan with them and let them know in no uncertain terms, we are not your emergency backup. Okay. We will always restaff if somebody calls in sick, but if there's an emergency and we can't come, we can't come. Okay. And the families need to understand that too, just because they're oftentimes going to be the ones who are on the hook to be the emergency backup. Now, if there's no family and the neighbor is not going to be helpful, or the family lives out of town or 2 hours away, and the client says, well, it'll be my daughter. Well, your daughter lives 2 hours away. She's not going to be able to get to you in case of an actual emergency. So that's not an answer. What is the answer? Keep looking. Some people will say, don't you dare register me with some government list. Okay, then you can't. But you could offer to help them with that. Some people just give them the paperwork and say, here, this is what you do. But in my opinion, in my mind, and when it comes to truly dealing with emergencies, it doesn't feel right to just leave them to their own devices and say, well, sorry, we're not coming today. Right? You really want to help them plan a little more. So have a look at what you've been doing with your clients for emergency planning. And maybe when you go back to do your next supervisory visit, consider beefing up that plan a little bit, making sure that they not only have that piece of paper, but that they've read it and they know what it means, or that they do have somebody in mind, and that there's maybe a list of phone numbers on the refrigerator, or, every it's so case by case. Every client's very different cognitively, physically, what they can handle, what their support system is. But I encourage you as owners and administrators of your home care agencies to look a little deeper and make sure that there is already a plan set in place. All right, I hope this is helpful for you. If you have questions, please reach out. If you're in Texas and you need an emergency preparedness plan, I do have one on my website, slusherconsulting.com, and I'll see you guys soon.